In Uganda, acute respiratory infections have remained the leading cause of morbidity and mortality in children under the age of 5 years, accounting for about 9% of disease prevalence, with 81% in urban areas. The acute respiratory infections and their related symptoms are typically caused by contagious viruses and bacterial infections that spread rapidly through droplets from either person to person or contaminated food or drinking water due to poor hygiene. Infections mean that there is prevalence of microorganisms in a place where they are not meant to be, either in the body or outside the human body. They spread in different ways. These include droplets, airborne, and through the mouth, and they are picked when a person gets in contact with contaminated surfaces. According to Dr. Joel Chimera, a pediatrician at IMC Hospital, most of the children who suffer from infections were not fully vaccinated against the known killer diseases.
The infections that they get, we do not get what we call herd immunity if these infections are vaccinated, for instance, are immunizable. If we do not get herd immunity, if we have a big number of people or children in that particular population who are not given that vaccine, then we have those children being probable candidates to carry or to sustain that infection within that community. So those become carriers of that infection.
Dr. Chimera says infections present with different symptoms like fever, vomiting, diarrhea, blisters, and these vary on the organ system where they stay. He, however, says many symptoms of viral infections present the same symptoms of bacterial infections, which require proper diagnosis from health workers.
Very important to present a child whom you suspect to have developed an infection to health workers. So yes, and apart from doing the symptom, taking the history, we can go ahead and do some investigations which can help us, to align ourselves to either a viral infection or bacterial infection.
He says diseases like whooping cough are still prevalent in Uganda because some children do not take the full dose of vaccination.
There is also the issue of herd immunity. We see it even in infection like whooping cough. Okay, it's still prevalent because people do not get, the third dose of DPT, Hep B. Yeah, many people do not access it. About 30% don't get it due to many reasons. So they keep that infection within still that community. So those children can still infect even those who are vaccinated.
Infections like flu and cough are common in school-going children who come home and interact with others they find at home, which makes the infectious cases recurrent. Dr. Chimera says irresponsible use of drugs also contribute to infections to recur in children.
Nutrition, especially in the form of hidden hunger, where we have, our children or even ourselves deficient, where we have our diet deficient of key nutrients like vitamin D, vitamin A, including iron deficiency, which is, one of the most common micronutrient deficiency. There is resistance, antimicrobial resistance, where drugs do not work appropriately. By the drugs which we used to use long ago, we find that they are no longer working, or the organisms are no longer susceptible to the drug because of so many reasons. Either drugs are being abused, the irrational drug use in the clinics, people prescribing these drugs without taking in due, in consideration, due knowledge of whatever they are treating.
Dr. Chimera says infections could lead to complications in children if they are ignored to be treated.
Definitely, any infection is death. And it's not surprising. That's why we talk about the under 5 mortality, the neonatal mortality, and the infant mortality. When infections are not addressed and they go on, getting worse from one stage to another. These same infections can lead, they can lead to other infections, they can lead to malnutrition, they can lead to diseases like epilepsy, infections, and they can be associated even including with the cancer.
Health workers advise that children should be vaccinated against immunizable diseases. Proper nutrition in form of a balanced diet should be given to children so as to improve their immunity. Dr. Chimera says the public should be sensitized about the signs and symptoms of infections and proper use of drugs to treat them. Sharon Twebaze, CTV, PM Edition.